Hi, I'm Tori with Pelvic Therapy Specialists, and today we're going to be talking about pelvic organ prolapse. Specifically, we're going to be talking about what it is, how it's diagnosed, and how we treat it from a physical therapy perspective. First, let's talk about your pelvis. Inside your pelvic cavity, you have three different organs. The very first organ that lives more towards the front is your bladder, and then towards the middle, you have your uterus, and then in the very back, you have your bowel. A pelvic organ prolapse is the downward descent of one or more of these organs, either into the vagina or into the rectum. Now, these organs are held in place by two different features. The first feature is your connective tissue, or your ligaments, and the second is your pelvic floor muscles. You can imagine your pelvic floor muscles like a hammock connected from your pubic bone to your tailbone, supporting those organs in place. Have you ever rolled your ankle before? Usually, once you roll your ankle, you roll it again and again and again. That's because once connective tissue or your ligaments are stretched, they tend to stay stretched and they don't regain their rigidity. We can't do a lot with pelvic physical therapy to address the ligaments. However, we can do a lot to address your pelvic floor. We can address your strength, your endurance, and your tone to try to give those organs some more support. Sometimes women will use a pessary to give some of those organs some support. This is a type of orthotic that's usually fitted by a gynecologist or urologist. If you've already been fitted for a pessary and are currently wearing a pessary, pelvic physical therapy is still a great option for you because we can still strengthen the pelvic floor muscles around the pessary. Some women with a more severe prolapse may require surgery. However, physical therapy is still a great option before surgery and afterwards. Before surgery, we can help you connect to your brain and your pelvic floor so that those muscles are a little bit easier to find after surgery. And some pre-surgical strengthening can help protect the surgical outcomes. In a typical pelvic physical therapy evaluation, we are going to be assessing the extent of your prolapse as well as which organ or potentially organs are involved. We're also going to be assessing your pelvic floor. We want to look at strength, endurance, and tone, and then create a custom home exercise program based on your presentation. Know that our exam does not involve stirrups or a speculum. Instead, we're going to use a single gloved lubricated finger to assess your pelvic floor. As you get stronger, we'll create more challenging exercises that mimic more functional activities that might provoke your symptoms now. Think walking, running, or maybe downhill hiking. Thanks for watching. If you are experiencing pelvic organ prolapse and you feel that pelvic physical therapy would be right for you, give us a call or visit our website and get that first appointment scheduled.